This is a presentation about ethics in psychological assessment. The main references for this discussion are APA Ethical Principles for Psychologists in Code of Conduct and PAP Code of Ethics for Philippine Psychologists. In APA, there are 11 ethical principles related to psychological assessments, whereas PAP has 10. Principle number 9 in APA is discussed in Principle number 3 in PAP. Similar ethical principles and its ideas are discussed both in APA and PAP documents. In discussing these principles, I will be referring to Carla and his client Carlos as our main example. Principle number 1. Basis for assessments. Reports should be based on substantial information and techniques as well as on adequate examination of the individual. Before Carla administers a battery of psychological tests and other assessment techniques, she has to first ask for Carlos' reason for referral and the objective of the assessments in general. Carlos wants to know more about himself and how the results of the assessment help him improve his performance at work. Principle number 2. Use of assessment. The use of evidence-supported assessment, which includes relevant and updated techniques, tests, interviews, and other types of assessments is a must. Carla then administers established or standardized psychological tests that can provide information to Carlos' career interests, leadership style, personality, or even work attitude. Carla also interviews Carlos and looks into other sources of information about Carlos. Principle number 3. Informed consent in assessment. An individual has to provide his or her consent for assessments, evaluations, or diagnostic services, except for cases when there is a need to have a competent representative in his or her behalf. Before proceeding with any assessment procedure, Carla has to ensure that Carlos is able to freely give his consent. Principle number 4. Release of test data. Test data should always be secured and only be released to the client. The assessment results are confidential and only be released to Carlos, who is the main client of this assessment service. No other third parties can have access to the results unless mandated by the law. Principle number 5. Test construction. The development of tests should be based on sound psychometric procedures and on current scientific knowledge. Carla may also use another tests which she created and can also provide relevant information to Carlos' referral question. However, Carla has to make sure that her test has sound psychometric properties, is valid, reliable, and adheres to the scientific process. Principle number 6. Interpreting assessment results. Interpretation should be based on the purpose of the assessment and other factors relevant to the client, including the limitations of the assessment itself. Carla should not only interpret the assessment results independently, but also has to relate and integrate these results to Carla's other relevant information, such as his personal history, work preferences, and especially the implications of these results to his work performance, which is the main objective of this assessment. Principle 7. Assessments by unqualified persons. Psychological assessment techniques should be conducted by qualified and trained individuals. There may be instances that Carla is out of her office and delegates the administration of the tests to her staff. She may do so, but she has to make sure that the staff is qualified, trained, and even licensed to conduct a specific level of tests. Better yet, the staff has to be supervised by her or by a qualified professional. Principle 8. Obsolete tests and outdated results. Results and recommendations should be based on relevant and updated measures. Throughout the process, Carla has to be selective in her use of psychological tests and other assessment techniques such that these have to be recent and follow rigorous psychometric procedures. Principle 9. Test scoring and interpretation services. The professional has to be responsible in the appropriate application, interpretation, and the use of assessment instruments. It's Carla's responsibility and her office in general to use tests and other assessment techniques that are relevant to Carlos and make sure that the scores and its interpretations are appropriate and insightful. For example, Carla needs to report the result of Carlos' career interests and explain how this career interest influences his work. Principle 10. Explaining assessment results. Make sure that the interpretation and explanation of the results are given to the client or a designated representative. Hence, Carla makes sure that the report is presented only to Carlos or a person who legally represents Carlos. Principle 11. Maintaining test security. Maintain integrity and security of assessment materials consistent with the law, regulations, and ethical standards. Finally, Carla and her office are mandated by the law to secure the psychological tests and other assessment facilities and materials to prevent theft, misuse, and violations to ethical standards. One of the misuses of psychological tests is reproducing copies for commercial purposes. In summary, APA and PAP principles of ethics are not only applicable to assessment, but also to other professional practices such as teaching and research. The ethical principles have to be complied with in whatever fields you are in.